Welcome back. You know, when you need to go to the doctor, many people typically do not consider if they're going to the right place for care, but not going to the right place, it can hurt you in more ways than one. You can have issues with the level of care you receive, how much you pay for that care, and how long you have to wait for your treatment. So here to help us clear things up right now is Dr. Mark Wisner. He is a family practice doc at Boulder Community Health. Thank you so much for being here.
Thank you.
Okay, so how do we figure out when you're hurt, where to go? What's the rule of thumb here?
It can be really difficult. People aren't sure. They have some sort of illness, they're feeling a little bit stressed, and they just don't know where to go. There are a couple of good things to do.
Okay.
First off, you can call your insurance. Typically there is a nurse or your primary care physician's office. There is a nurse on call. You can tell them your symptoms, and they may give you an idea of what the best appropriate level of care is.
Sure.
One other thing to do is at your annual exam with your primary care physician. Ask them,
okay,
hey doc, does your office do this? Do you guys treat broken bones? Do you do stitches? If I have severe abdominal pain, where can I go for care? And they can give you an idea.
Yeah, because the big concern, a lot of us nowadays, our deductibles are pretty high. And so if you go to the emergency room, that can cost you a lot more than, say, going to urgent care.
Yeah, the cost of care varies greatly. I was just looking at sort of average care for the most common reasons, or average cost of care for the most common reasons to go to the emergency room. So sprains and strains and upper respiratory infections. If you go to the emergency room for one of those, for a sprain or a strain, typically average about $1,000. And that's just not you're complaining of that, but that's your actual diagnosis.
Sure.
You don't have a fracture. If you go to urgent care or to your primary care doctor's office, it can be somewhere around $250 to $300 on average.
It's a huge difference.
Major difference. Say a strep throat or a sore throat, difference is $500 to $100, something like that. And we're paying for most of that now with our high deductible plans.
Right.
It's not going to the insurance, so it's a big difference in cost.
Now, do you find some family practice doctors do different things? Like some offices, they may handle the breaks, and others send it off?
Yeah, I think all offices are different, and that's why it pays to talk to your primary care physician and ask what they do.
Sure.
Some offices, like the offices at Boulder Community, we have same-day appointments that are set aside. We can't schedule them until the morning of that day, so that people who, overnight came down with a sore throat, that cough got much worse, they can get in to see their primary care, the person who knows their past medical history, the person who kind of knows where they're coming from, can care for them that day. Not all offices do that, and so it pays to talk to your doctor about that. Can I come for this care?
Yeah. Okay, all right, Dr. Mark Wisner, thank you so much. Good information for all of us to break down, because when it comes to medicine, there's a lot of questions out there. So if you want some additional information, just visit whereforcare.org. You can see it, we've got it on the bottom of our screen right there. Let's send it over to Lisa. Lisa, I think the forecast is calling for people to call in sick later on this